Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
Hi, my name is Charlie. I was diagnosed with type 1 diabetes when I was 5 years old. My treatment has evolved with a series of aha moments. That first aha moment is actually one of the most memorable for me. It was the summertime, living and growing up in southern Rhode Island. I was a really active young boy. I had played multiple baseball games, had gone to the beach twice that day, we had been swimming in the pool, and I started to feel a little off. We were throwing all of the tried and true methods of the early 80s at it. Orange juice, gel, glucose tablets, frosting, cupcakes, cookies, nothing put a dent in this low. And I ended up having to go to the hospital, and I didn't have to use glucagon. I never passed out in a seizure-like event. However, it did take some time to stabilize that severe hypo moment. And that was kind of the first aha realization, not only for myself as a young child, but then also more importantly for my parents as their primary caregivers of me at the time. So shortly thereafter, the prescriptions were filled for glucagon. The little red boxes showed up everywhere, and they were strategically placed throughout the house, in the automobiles, just about everywhere you look. Fast forward about 16 plus years later, the second aha moment took place. At the time, my girlfriend lived here in Rhode Island, and I said, I'm not feeling well, I'm gonna come down from school. And we ended up watching a movie, ended up falling asleep, and actually in my sleep, I went into a full seizure. And it was a severe hypo moment in which it was very dangerous, and it was really problematic, largely due to the fact that we didn't have glucagon at the time at my girlfriend's house. The EMTs arrived after her calling 911, and it took them about 20 minutes to get me to come to, and that was through a lot of use of orange juice and sugar and gel underneath the tongue. Surprisingly enough, glucagon wasn't in the ambulance as well. So there was, again, not a rescue kit to be found in that moment. And so that second aha moment kind of really threw me into adulthood with T1D. Fast forward to summer, and I'm out with some friends to celebrate an individual's birthday. We have a great time, come home, go to bed, wake up the next morning and walk downstairs, and my mom said to me, "Are you feeling okay?" And I looked at her, blinked 3 or 4 times, passed out, hit my head on the counter, went into another full seizure. And my mother, who's always been by my side in this journey, jumped into action, grabbed out of the classic quintessential junk drawer that's in everyone's kitchen, the glucagon kit, administered the glucagon, and dialed 911. The EMTs came, and the glucagon, and in that case, really obviously was used in a true rescue event. My 3 aha moments really has taught me that glucagon is one of those essential tools that you have to be armed to the teeth with, and it's better to have it and not need it than need it and not have it. And the reality is glucagon is that safeguard to that unexpected, severe low event where you don't see it coming. And if we want to be responsible and we want to take good care of ourselves, we also have to prepare and train and provide the necessary tools and safeguards to those loved ones around us. I have 2 boys, Peter and Thomas, 7 and 5 years old, my wife, Katie. So we're an active family. The great thing about Gvoke HypoPen is it allows me to carry it on my person, in my backpack. We feel lost if we leave our house without our cell phone. In 2021, anyone living with T1D should feel lost without glucagon. Gvoke HypoPen is manageable in the sense that the instructions are very straightforward. We are not perfect as humans, and we are certainly not perfect as patients, and you should not be a perfect patient. I'm a firm believer that my 3 aha moments, they have better prepared my family and loved ones to help me in this journey. Do your research. advocate for yourself relentlessly. It's how you manage your disease. And the better you manage your disease, the longer, happier, and fulfilled life you'll live. It's okay if you make mistakes. Let those mistakes teach you lessons that you'll carry on for the rest of your life, but also be able to share those lessons to make somebody else's journey a little bit easier and a little bit more efficient until a cure is found one day.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke. Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.